Hi everyone, my name is Dr. Tiffany Mullen and I'm the CEO and co-founder of Vital Health, and I'm also an integrative and functional medicine physician here. This is a really important topic. Inflammation is associated with so many problems, both a cause of problems as well as an outcome of problems, that I thought it'd be important for us to take a closer look at how we can lead a more anti-inflammatory life and thus obtain better health overall. So let's get started. So here's what you're going to learn during this brief presentation. We're going to figure out what inflammation is and how we actually detect it in our bodies. We'll find out some of the common causes of inflammation, and then 3 approaches that we can use to decrease inflammation that are relatively simple, but very, very powerful. So let's get started. What is inflammation? So inflammation is essentially defined as a response triggered by damage to a living tissue. It is a normal response, and in fact, it's quite helpful for us. If we have an injury, we send blood both to help nourish the injury, provide the white cells that are required for healing, and actually swelling to stabilize the injury, and redness to attract more blood flow to the area. So inflammation is actually a very important aspect of our health, and without it, we would be in bad shape. So it's actually a good thing. There are 2 types of inflammation, however, and I think you can see here that too much of a good thing can be not a good thing. So if we look at acute inflammation, that meaning sort of an injury, a cut, an abrasion, a scrape, a sprained ankle, there is a good inflammation that kicks in this situation. We have a protective inflammatory response where we send those white blood cells over, those the cells that allow for healing. We send protein to the area, we send oxygen to the area to try to heal the problem, and then we heal it. And we send in some anti-inflammatory cleanup cells afterwards, and problem solved. We go on with our day. What happens, unfortunately, with chronic inflammation is that there may be a trigger, such as an injury or some plaque building up in an artery or an inflammation of our gut. We may not know about it. We may have symptoms related to it, or we may not. And it goes unchecked, and we get an imbalanced inflammatory response where we are continuously sending red blood cells, white blood cells, inflammatory markers over to this area to try to manage the problem. And again, it can be undetected by us, and in that way, it never stops. It just sort of perpetuates. And that type of chronic bad inflammation is what we associate with a lot of disease processes. So we're going to talk a little bit more about that. So as I said, acute inflammation, those things that happen to everyone, cuts, bumps, bruises, frostbite here in the north, Great White North, allergic reactions, burns, infection. However, in the chronic type of inflammation, we're seeing where diet can be causing inflammation, autoimmune disease, again, known or unknown, poor sleep, stress, smoking, our environment, toxins in our environment, even our social environment, and certain illnesses can cause a state of chronic inflammation that, again, can be quite damaging to our bodies if left unchecked. How do we detect it? So sometimes it's really obvious, right? You have an injury, you can see the bleeding, you can see the swelling, you have a sprained ankle, it hurts. It's pretty obvious to understand where the inflammation is coming from. However, if you weren't aware of whether you had inflammation in your body, there are some ways that you can test for it. In a sense of general inflammation, not just necessarily associated with joints. I know I have a picture of a knee here, but in general, you can check a test called an erythrocyte sedimentation rate. We shorten that to SED rate. We also can check a C-reactive protein. We abbreviate that CRP. And we can also look at omega-3, 6, and 9 levels. And I'll go into a little bit later in this presentation about how those need to be in balance for appropriate inflammation and anti-inflammation. All of those things can be detected in a blood sample. When we're talking about inflammation that's specific to the gut, we can check in the stool, typically in a home-based test, fecal secretory IgA, which is an inflammatory marker typically associated with food sensitivities, but not always. We could also look at eosinophilic protein X, abbreviated EPX, and also calprotectin. Those are all markers within the gut that we can use to detect gut inflammation. Obviously, we would also be looking at things like white blood cells in the gut, as well as potentially red blood cells, which would indicate a source of bleeding. Obviously, not good in the gut. But a lot of information can be obtained about gut inflammation if we know to look for it. In the cardiovascular system, where a lot of people have inflammatory processes happening, vascular system is inflamed and is starting to develop plaque, there are tests that we can use that help us derive a little bit more specificity around vascular inflammation, and that is a high sensitivity C-reactive protein, hsCRP, which is also called sometimes cardio-CRP. And although it is not completely specific for the vascular system, it does a better job of delineating potentially that inflammation is coming from that source. So as I alluded to earlier, there is a really distinct difference between omega-3s, which are a certain type of fatty acid in our system, as well as omega-6s and 9s, just in terms of how they're structured, but also how they're derived. So omega-3 fatty acids come from alpha-linolenic acid, ALA. Sources are flaxseed and all kinds of nuts and seeds. Olive oil is rich in ALA. And then that gets converted to something called EPA and then DHA. Those two, EPA and DHA, you may be familiar with. That's oftentimes what you'll see on the back of a bottle when you're looking at fish oil. Those are the two active omega-3 fatty acids, and those are potent anti-inflammatories in the body. Conversely, on the omega-6 and 9 side, these are derived from linoleic acid, what we abbreviate LA, primarily from corn sources in our country. And then corn is obviously fed to a lot of animals. And when we consume those animals, like cows or chickens or pork, we're consuming a lot of omega-6s and 9s. They're also plentiful in what we would call junk food, just a lot of corn-based foods out there. That gets converted into arachidonic acid, and then that is very pro-inflammatory. So you'll see that there's this balance, a scale at the bottom. You need both anti-inflammatory and pro-inflammatory approaches. Obviously, I said earlier, if you injure yourself, you want to inflame to actually get better, and then you need to clean it up with an anti-inflammatory approach. So you need both. In many millennia ago, human beings had an omega-6 to 9 to omega-3 ratio of about 2 to 3 to 1. So a little bit more omega-6s and 9s than omega-3s, but pretty close. Nowadays, the average person who consumes a typical American diet or standard American diet, they will have a ratio of something like 20 to 30 omega-6s and 9s to 1 omega-3. So really skewed on that scale to pro-inflammatory food. So just simply making some changes to the consumption of omega-6s and 9s and omega-3s can be hugely helpful. Obviously, we associate omega-3s with fish and fish oil. There are vegetarian sources as well, like seaweed and flaxseed and walnuts. You can actually get omega-3s in beef and other animal that you would typically associate with omega-6s and 9s if it is grass-fed. So if it is not corn-fed, it's actually higher in omega-3 fatty acids. So those meats are not necessarily high in omega-6s and 9s on their own. It just depends on what the animal eats. What they consume gets stored in their flesh, and then ultimately we get to take that into our bodies as well. So how do we decrease inflammation in the body? I'm going to go through 3 ways, very simple ways that you can decrease inflammation in your body. Number 1 is to decrease triggers. So some of these you may know. Perhaps every time you eat wheat or gluten, you get a stomach ache. Well, probably that means that it's inflammatory. You can also test for food sensitivities. This is a simple finger stick blood test done at home. In this particular case, this person is quite positive. You can see those long bars heading over to the right for dairy foods, all the different dairy foods, very, very sensitive. That in this particular individual was leading to a condition called leaky gut, where the gut was inflamed, large proteins were crossing over, triggering the immune system in the gut, and there was this chronic inflammation that was happening in the gut. So finding the triggers, whether it's an autoimmune process, a food sensitivity, an infection, something that is happening in the body, and decreasing or stopping those triggers is obviously key in controlling inflammation. The second thing that's really important to do is consuming anti-inflammatory foods. So the exact antithesis of the standard American diet, or what we abbreviate as SAD appropriately, things that are rich in whole foods that come from nature, lots of omega-3s, lots of vegetarian sources of fats, berries, etc. These nutrients are high in omega-3 fatty acids. They're also very high in fiber, both soluble and insoluble fiber. They're low in simple sugar and simple carbohydrates, which we know are difficult for us to process most of the time. And we want to avoid trans fats in our diet. Those are things that are partially hydrogenated. A lot of snack foods have those in them. Even if it just says a trace of them, those are very pro-inflammatory. So consuming an anti-inflammatory diet is a well-studied way to decrease inflammation in the body. And then the third approach is to take anti-inflammatory supplements. And obviously this can be customized based on your needs, based on how much inflammation you have in your body, where in your body you have inflammation. You can work with your clinician to figure out what is the best approach. And these are just a few of them, my favorites. I love turmeric. It is typically standardized to curcumin, and we typically dose it at 500 milligrams twice a day, but some people take a little bit more, some people take a little bit less. Turmeric, as you can see, is that orange powder on the left. It's found in curry, although curries are delicious and very healthy. You typically can't eat a lot of turmeric in that way, but certainly doesn't hurt to eat it. But the capsules just allow you to get a higher potency dose. That'll go a long way to being an anti-inflammatory. I refer to turmeric and curcumin as my herbal ibuprofen or herbal Advil, because it works for me just as well, and many of my patients just as well as Advil, without the side effects, without the risk of gastric ulcers or kidney problems or high blood pressure. Just a really great potent anti-inflammatory. Obviously, we've talked a little bit about fish oil, omega-3 fatty acids that are concentrated. Dose matters. So if you look at the back of the bottle when you're looking at your fish oil to purchase, you want to look at the DHA and EPA, remember those important actual omega-3s, and you want to get them to add up together, their doses, to at least 1,000 milligrams daily. You can go higher, but at least 1,000 milligrams daily of those two things added together. The front of the bottle does not tell the whole story. A lot of times it'll say 1,000 milligrams, but that'll be a whole bunch of different fatty acids, not just the omega-3s. So make sure you pay attention to the back of the label of the bottle. And then ginger. I love ginger as an anti-inflammatory, particularly for gut inflammation. It does a really nice job of soothing gut inflammation, does a really great job of that. And typically we dose that at 450 milligrams 2 to 3 times a day, although again, you can take more. I love other anti-inflammatories like cat's claw and boswellia. There are so many great anti-inflammatory supplements out there that are really safe and do really help a lot with controlling inflammation in the body. I'm going to throw in a last little consideration here, something called Lowdose Naltrexone. We call that LDN. LDN is a really interesting compound. It was developed as a pharmaceutical, naltrexone, which is a brand name Narcan. And we actually use that in medical practice for opioid overdose. So when somebody has a heroin overdose, we administer a higher dose naltrexone, and it blocks all of their overdose receptors, and they bounce back to life. It's quite shocking to see. However, when we talk about low dose naltrexone, we're talking about 1 to 5 milligrams, sometimes less, of naltrexone. It has a very interesting effect on the body in that it really decreases inflammation. It can have an impact on autoimmunity. So I use it a lot in patients who have Hashimoto's, hypothyroidism, rheumatoid arthritis, lupus. It can be very helpful in really slowing down that autoimmune process. It's a very interesting medication. It is prescribed and it is compounded, in other words, made custom to you. It's not something that you could buy over the counter, but it is something that is quite helpful in the inflammation conversation, and that's why I thought it'd be important to just introduce it here. Thank you so much for your time. I hope this was helpful. Please get in touch with us if you have any questions, www.vitalhealth.com. That's our phone number, and we're also on social @YourVitalHealth. Thanks, everyone.